the reason I got into this in the first place is because when I was doing total knees, and, the community was saying we're operating on too many fat people. And, the fat people have higher rates of blood clots and infection rates and wound complications, and they don't rehab as well. So we were like, as a community, like all of us stood together and said, hey, we're going to BMI over 35, no surgery for you, unless you go through some sort of weight loss program. But they didn't give us any sort of like, this is how you do it. It was kind of left to our own devices. So I would put my patients on ketogenic diets, or try to, only maybe 20% would actually do it. But the thing that really blew me away was I had people with, legit shitty, bone-on-bone arthritis that I had on the OR schedule. And they come back to me, 2 weeks later and said, you know what, Doc, man, he doesn't hurt anymore. That was the first thing that kind of raised the sort of the hair on the back of my head, saying, wait a minute, what's going on here? So that was kind of how I got into this. And so I found that, believe it or not, a lot of these conditions, and even if you end up going through surgery, like there's some people I still take to the OR, but they would recover better. I mean, they'd be sitting there, post-op day one after a total knee, like, I don't have much pain. And, again, we've gotten better with the regional catheters and the PCAs blocks and all that stuff, and blocks and all that stuff. But even still, it was noticeably better. They were just not as inflamed. And again, that predicts better wound healing. And so, and I mean, when you look in the literature, like for instance, if you look at the literature for like trauma patients, like burns and things like that, but also for like big operations, it's recommended you increase the protein intake by about 10 to 15% over for that month afterwards. And so again, that's just going to put things in your fever. Hey, go eat a steak every day, dude. Just give them permission to eat a steak every day for the next month after they had their surgery. And you probably will see your outcomes better. I mean, this is something that I think it'd be nice to do a little fun little, intervention trial and see how that does. You can get historical numbers versus this sort of intervention.
And we need the American Beef Association to fund it.